I recently wanted to find out what some of the billing issues are with regard to health insurance from the perspective of a health provider. So I reached out to a local large hospital that I thought got so many claims and different kinds of claims and patients and billing that they would have a really good perspective of what some of the issues are. So I spoke to a billing manager and I asked first, where do you see most of your billing issues come in? And by billing issues, I meant like patients get a bill and they call you complaining or with questions or they need help. And she said, it's definitely the public insurance has no problems compared to the private insurance. And the public insurance is Medicare and Medicaid, and there's state and federally funded programs. Medicare is generally for people 65 and older, and Medicaid is for children, people who are disabled, and there may be some other details that I'm not as clear on. And then some states have more of a universal coverage, and those might fall under that too. So the publicly funded plans, the public plans, she said, they're just paid. Medicare, Medicaid, they pay the bills, they pay the claims. And if they don't cover something, then they're willing to work with the patient to have a supplement, have them purchase a supplement, upgrade the type of plan they made. So just with some documentation, they're able to get them the coverage they need to take care of that particular claim. Because sometimes you end up in a hospital for something that you weren't expecting, and but that can be fixed afterwards. That is not the case with private insurance. So she said private insurance has much more problems from a patient perspective. And so pardon me, and the private insurance, that is your Blue Cross, your Aetna, United Healthcare, Harvard Pilgrims, Leahy, those plans that you buy through your employer or a group of some sort of through a broker. And the reason I asked, what is the overriding theme? Like, what's the biggest problem you see with regard to these private insurance, these bills, the patients having problems with bills? And she said, it's they don't know their plans. And I really stuck me that she said that people will not realize they have a deductible, or they don't know what their deductible is, or they don't know what a deductible is to begin with. And or they don't realize that there's a higher copay for a certain thing, and they're just not prepared. They don't understand their plans or how to use their health insurance. And that really struck me because I know that so many people just look at the premium and that's how they choose their plan. And they don't understand words like deductible, coinsurance, copay, or what a premium is. And then they get stuck in these moments where they have these bills or they have to use their plan and they're not prepared. So I am here. This is why I do this work, is to help people understand their plans before they purchase them, before they enroll, how to use it at the time you need to use it. So if you definitely have any questions, please leave them in the comments or message me. I'm happy to answer short questions. And if you like this content and you want to learn more, please like and follow me, and let's build a community of learning more about our health insurance, because it's definitely needed here in the United States.